This is the CUNY Cast, smart voices, good stories, and thought-provoking conversation from the City University of New York. I'm Rick Firstman.
There's different reasons that people are giving. And we've even asked in Harlem, why not? And some people still say, I don't feel I need it. I don't trust it yet.
At the one-year mark of the COVID-19 pandemic, it's all about the vaccine. A lot's changed since the chaotic early days of the rollout just a couple of months ago. Now that the supply is opening up faster than anyone expected, the X factor is the demand. Will so-called vaccine hesitancy or outright refusal prevent the U.S. from reaching the 80% vaccination rate necessary to end the pandemic? Dr. Scott Ratzan of the CUNY Graduate School of Public Health and Health Policy joined us last spring to talk about what the school's weekly COVID tracking survey was revealing about the impact of the pandemic on New Yorkers. He's back today for an important conversation about the nation's great vaccine challenge, convincing the hesitant, the skeptical, and the deniers to roll up their sleeves. In fact, Convince is the name of a global initiative that Dr. Ratzan is helping lead to promote vaccine confidence and acceptance around the world. Dr. Ratzan is a prominent public health physician and the founding editor of the Journal of Health Communication, International Perspectives. Dr. Ratzan, welcome back to the CUNY Cast. You spent much of the past year looking at public attitudes about the virus and how information and misinformation has influenced how people think and act. Now you're one of the leaders of a global campaign to raise what you're calling vaccine literacy. It's called Convince, certainly an apt acronym. Tell me about it.
Well, Rick, thank you for the opportunity to come back here today, a year into the pandemic. And 1 year ago, on March the 5th, we actually published something in the National Academies of Medicine Perspectives, and it was called An Urgent Call for Coordinated Trusted Sources to Tell Everyone What They Need to Know and Do. And this became the fifth leading paper in the National Academies for last year, and in it was very specific. We said that we should have a leading governmental spokesperson or a medical spokesperson that would create a credible public-private interdisciplinary COVID bureau to inform the U.S. and inform all of us about both the facts, the evidence, and what we need to do. And this was built on history of the knowledge of how to address pandemics or epidemics or even outbreaks, and that we know that informed, activated population is what's vital to protect the public health. So what we began to do while we put this call out there, we saw that this frankly hasn't happened. It didn't happen in Washington. It didn't happen with the Surgeon General. It certainly didn't happen with the different challenges that we had between President Trump's administration, the state, and even local authorities. So what we set out to do is a series of dialogues, and we called it Convince, ultimately. These dialogues were with CUNY School of Public Health, the London School of Hygiene, Tropical Medicine's Vaccine Confidence Project, a group called Wilton Park, and 75 different networks over time. And Convince, in short, stands for COVID New Vaccine, Information, Communication, and Engagement. And this initiative, which is both global in scope and also Convince USA at CUNY, is doing all of that, gathering the information of what we need to know and do, communicating the information, and in some cases it's research and reminding us of the disparities that exist. And then finally, the E for engagement, how we're engaging with communities at all levels, not just academic communities, faith-based communities, governmental, workplace, and so forth. So that's what we've been about. The Convince initiative is growing. We have attracted support from the Commonwealth Fund for the research at CUNY School of Public Health, the CDC Foundation, and a variety of other groups as they see this as an integral opportunity for our work.
So you've been working on this in the various aspects as the pandemic evolved. Your tracking surveys, the School of Public Health at CUNY, last summer found that even here in New York, not much more than half the people said at the time that they'd take the vaccine if it were available then. It's better now, right? But there's still a barrier, whether it's you want to call it hesitancy or reluctance or downright refusal. But that's not really a new phenomenon, right, in terms of vaccine?
No, I mean, Rick, thank you for pointing out both of our surveys and so forth on this unfortunate aspect of vaccine hesitancy. In 2019, the World Health Organization called vaccine hesitancy one of the top 10 threats, similar to climate change and others. Not maybe in scope, but certainly that needed a focus. The unfortunate piece that happened is that vaccine hesitancy started to affect measles, started to affect other vaccinations, and then came COVID. And this hesitancy has piled on in other areas. And we have seen in New York about 54% of the population at one point only willing to get the vaccine. Since the vaccine is out there, and since unfortunately many people have died from COVID, more people are willing to get the vaccine, but it's not universal. In the United States, there's a good part of the population that are skeptical or deniers. And then there's a sort of wait and see population. And we think that all of the wait and see people are waiting for the data and the evidence and seeing that others are getting it and getting back to life that they knew. So we expect we'll be able to get to probably 70% of the population. However, as you mentioned, we need herd immunity, which is 80% of the population. And it's going to be difficult once we get to a certain level to get the right number of people vaccinated throughout the country that are eligible to achieve the herd immunity, or what we also call community protection, so that we don't have to worry about massive outbreaks or epidemic proportion of future coronaviruses.
I'm curious about regional differences, and if say in New York we were able to get up to the 85%, but there are other parts of the country, rural areas maybe, that don't. What what's the level of protection you think that we'd have in New York?
Well, I mean, a lot of this will be speculation because the great part of New York is that so many people come in and out internationally. Every day you've got over a million people from Connecticut, New Jersey, so forth. So ultimately, we need to have the virus, as little of it circulating in the population, and as many people as possible vaccinated. I think we could get to a point where we basically do have the kind of protection that we need with vaccination in the 70 to 80% range. Still, the protective, the mask wearing, the social distancing, and the other pieces that will be necessary if you have unknown audiences or unknown people that are coming in. So I think we're going to have to evolve. I don't think this will be settled by the end of the year, but we could be pretty close, hopefully, by the end of the year to reach that 80% and be able to enter the new year with some confidence that we could be protected. We'll have new vaccines, potential booster vaccines that might be necessary, but I'm less concerned about everyone in New York. I am concerned if we have a checkerboard approach across this country that we never get the vaccine or the virus eliminated or eradicated, or even at a low enough level that we'll continue to see outbreaks. And that's why we really needed to be front and center with both Convince and other areas to get as many people vaccinated in this wave, which is the first wave of vaccinations, that we possibly can.
And the same goes for internationally, right? That's why we this got out of control in the first place.
Yes, international. We're not protected until everyone's protected, and unfortunately, right now it's only the U.S., the U.K., and Israel that are leading in terms of the percentage of a population of large-ish countries, if I can say that, because some of the island nations are getting vaccinated very quickly. But we will need to have global coverage. And I know in Africa, where the target is only to get to 60% within 2 years. Now, a lot of those people are not as mobile and coming to New York, but we are going to have to get the whole world vaccinated to a level to get the virus as low as possible. I mean, look, we had to do that with polio. We've got rid of polio on the Americas and the Western Hemisphere, but it still is endemic in a couple countries in the rest of the world. Smallpox is eradicated from the planet, but that's the only a viral disease that we've been so effective in. We have to just think of getting this to a controllable level, and then hopefully figure out a way to keep us protected from COVID.
I wonder if you can tease out a little bit the fears um, and how they might be different in this case compared with the generalized anti-vax attitudes that we've seen over the past decade or so. Is there a difference?
Well, I think that any of these diseases, the novel nature of it is what is first. What is it called? And we get the SARS-CoV-2. You hear, then we coronavirus 2, and then we have these new variants with new numbers, and then we all these other challenges are also communication challenges. So first of all, there are some people that think COVID was a hoax, and that was said from the highest level in the federal government last administration. And we had others that still don't believe it's such a risk or harm to them. And those are the ones that are more apt not to get vaccinated. In this country, unfortunately, it is broke where Republicans are double digit points different than the Democrats. So there's an ideological issue. In New York, we've been running a bunch of these surveys, a CUNY tracking survey since last March. And most recently, we did one in Harlem. And Harlemites had some very specific concerns. But it wasn't that they didn't want to get the vaccine, because 4 out of 5 are willing to get a vaccine. They would like to get it. But right now, as in March of 2021, they don't have enough vaccines yet. So some people are still waiting for scientific explanations from a trusted source. Others want to wait and see how it works, as I mentioned earlier, about 30% of them there. But others want to have those that are higher risk get it first. So there's different reasons that people are giving. And we've even asked in Harlem, why not? And some people still say, I don't feel I need it. I don't trust it yet. Others have medical issues that they say, even though the medical issues really are not a barrier unless it's specific by a physician. And then others still want to have more information or more assurances on allergic conditions that might happen, or they need assurances from others who've received it. So we know that some of this is a communication challenge, and we also have to make it as simple as possible and as easy to get the vaccine as possible. And many people are still getting their information on how to get the vaccine from podcast, from radio, and television, whether it's cable news and local news. So we have to do a good job of getting these kind of discussions out there, and then give people the confidence to get the vaccine at a place that's easy for them to get it. And frankly, in Harlem, many people would like to get it at doctors' offices, hospitals or community health centers, or pharmacies. They don't want to go across town to big sports centers.
So I'm wondering if the racial difference is really bearing out. I mean, we were hearing for quite a while about lack of trust in vaccines among the African American community, rooted in the infamous Tuskegee experiments of the 1930s. But I think aren't we finding that that vaccine hesitancy is actually pretty equal between blacks and whites?
Yes, I think the more we do find and look at the data, we do find it is similar, but it breaks upon other variables, which also, as I mentioned, the ideology of political affiliation. But we also found that, like in Harlem, for example, 3/4 of Harlemites, trusted that COVID vaccines will be available to everyone. They believe the equity is there. It's a little lower amongst black respondents, though. So it's not only just trust in the vaccine, it's also just trust in the whole system of, is it fair? And this is the whole, racial injustice and some of the structural racism that's out there that's finding its way into the vaccination area. But in terms of the hesitancy at the individual level, no, it is not directly, racial orientation that we would say across the board. And it is wrong for many people to think, oh, it's just because somebody is, of color or of a particular region that they will be less apt to want to get a vaccine. We really need to understand it well, and that's what we're trying to do with Convince and with these studies. We have a qualitative research study supported by the Commonwealth Fund, where we're asking some very strong, in-depth interviews of understanding one-on-one of why people are vaccine hesitant, and then obviously we want to also bring that amongst groups and know how we can move from hesitancy to acceptance.
So what sort of misinformation or mythology or um, whatever you want to call it, is the hardest to deal with.
What we looked at early on is this whole misinformation area, that the vaccine deniers and the skeptics and those that some of whom join QAnon and these other groups, there are people that are more apt to believe conspiracy theories and the fact that COVID might have come from an outside source or made in a laboratory or whatever it might be, that tend to have a narrative that are more difficult to change. Now, in the old days, and vaccine hesitancy and skepticism has been with us for centuries, really, ever since vaccines first started. It used to be that you would be able to shall we say, keep those people in a certain area, and there'd be a small number that would be eliminated with geographic or other limitations. Now with social media, this could happen very fast, and we saw that with the social media. Instagram, some of the Facebook gated communities that people had themselves. And we've tried to highlight that enough that Google and Facebook and Instagram and Pinterest and others would take some of this stuff down. YouTube has tried to scale out those pieces that are not true as well. Having said that, they haven't been able to do that very well, so you still have a baseline of skepticism that continues. We have to stem it at its source, but also have the same dosage of information that is ethical and as straightforward as the information that is wrong and misleading. And today, as always, as has been traditionally, more people are interested in what might stick out. If it bleeds, it leads. It's in the news, it's in the social media, and the tried and true scientific medical establishment, vaccine works, you need to take them, you need to wear a mask. Those messages don't get to the same level as others. So we need to really do this in a systematic way where everyone is talking about it with, yes, this is what the science says, or this is what the medical docs say, whether it's in Washington in a white coat, whether it's in New York in the medical practice that they go to, or the hospital that they trust. That's what we need to do. And it's been very, very difficult to do that well in the way the media landscape is today.
Yeah, I mean the politicization of COVID, is from the beginning, it remains very troubling. It's been masks, but now there's a new poll out from NPR, PBS, and Marist found that nearly half of Trump voters said they will not get the vaccine. That's a tremendous number of people. It's millions. Um, what do you have any any strategies, any thoughts about how do you reach people who are locked in that way on in some sort of a a political uh, digging in that way?
Sure. Well, I mean, first of all, it would have been great if Trump would have acknowledged the threat of COVID and also taken his vaccine in public like other presidents have. And it's just the unfortunate nature of confluence of time and history and the nature of former President Trump, how he decided to communicate. So I don't think we can wait or hold our breath for the president or former president to do anything. In fact, the less he says on some of the COVID piece, maybe the better it is, because he said so many different things from bleach to hydroxychloroquine to you name it. So he is not the credible source that we need. There's another aspect that we've taken with Convince, and there's a group called Business Partners to Convince. And I say that because, business are all people, Republicans, Democrats, independents, workers, unions, and so forth. And we believe by the workplace and the employer, who has been a trusted source and continues to be one of the most trusted sources for people, is the place to help make a difference and to stem this. So what Business Partners to Convince has put together is a global COVID-19 workplace challenge. And the goal of the challenge is for companies and the respected leaders, from the CEO to the line manager, to embrace some basic principles. And by embracing these principles and educating their public and providing the information, that will stem the vaccine hesitancy and bring a bandwagon effect that we're all in this together. We're all working, we're workers, we're employers, we're together at this workplace and the virtual workplace, and we'll eventually get vaccinated. And I'll just read the 6 principles. They're very simple, and it's a challenge that anybody can sign up for. It could be a big private company, a big public company, a big municipality. 1, listen to employees' needs and concerns about the impact and prevention of COVID-19. Listen by surveys, hotlines, whatever it might be. Follow the latest public health guidance so they have hand washing to protect myself, my employees, my workplace, my customers, my community. Basic principles, easy to follow. Promote vaccine literacy based on the scientific evidence of vaccine benefits and the risks. So it's the reality of promoting the literacy. 4, encourage vaccine confidence and uptake. That's by making it easy and popular. 5, advocate for accessible, equitable, and timely vaccination of employees. Everybody should have equity of access, and it's free for everyone in the United States. And then finally, engage with community, schools, faith-based organizations, and public health leaders to stem the spread. If you do these basic pieces with the most trusted people, in many cases, or their employer or people that they work with, we think this can overcome a lot of the vaccine skepticism, and particularly that may have come from, as you say, the last administration.
So I just want to step back for a second and to the tracking surveys of New Yorkers' attitudes about the pandemic that you've done over the past year. You did weekly surveys last spring, a couple in the fall, and then one in January. Can you update me a little about the impact of the pandemic a year later here in New York, particularly in terms of economic consequences and also mental health? Where are we now compared to a year ago, or the early stages?
We've been fortunate that Vicki No, who's a professor at CUNY School of Public Health, has an Innovation and Mental Health Institute, and she's been part of our research team and has really been tracking anxiety, also some of the discrimination amongst members of, whether it's Asian populations and others, that really have been unfortunate. I'm talking about the latter part on the discrimination. We do see a large level of resilience in the New York population, and that's a good thing. There were parts during the pandemic that it was lower, and I frankly, don't want to say that a part in time when it went from 40 to 50%, because the numbers are not important. It's the trend, and the trend is that now that there is hope in sight and people are going back to work, now that we actually have a package that I think a relief package that people are no longer concerned or not as concerned about evictions, about job losses, because maybe they've already had that hit, unfortunately. We're finding that there is a lot more hope on the horizon. We also measured that after the last election, that when the Biden was elected and then inaugurated, we saw the tracking it actually also going up significantly, that people are more trustworthy of the institution of government having the right response. So overall, I think we are not out of the woods yet. We're definitely still in the forest. We need to address the mental health challenges and give people the resources that unfortunately we might not have enough of, just the way mental and behavioral health has been in the city. But our survey has hopefully shed light on it, and we'll be able to have more data and then share some of those specifics of what are the parts that are most challenging when we review the latest parts of the tracking of New Yorkers in the last 4 months. We did this before the election, after the election, and then after the inauguration. And that's a data set that Rick, we hopefully could share with you in the future.
Yeah, I think it's a balance. Most of us are starting to feel hopeful. We're seeing the light at the end of the tunnel, but trying to balance that hope and optimism, which we all really need, against the caveats about what can still go wrong, and really the X factor of the variants. I mean, how does that figure in? Because we have a New York variant now, right?
I think the variants are real and are a concern. Fortunately, right now it appears that the variants, one, yes, they're more infective, but they're not more deadly. Two, the current vaccines that are out there protect against the new variants that have shown up. So we just need to get people as vaccinated as fast as we possibly can. We need more vaccine out there. We need more distribution sites. We need more confidence for people to get their first and second dose. If you have the Pfizer or Moderna one as a first dose, the Johnson & Johnson single dose vaccine also provides some coverage. So we need to get as many people vaccinated as fast as we can, and hope that we get a lower, as the age group gets lower in terms of both approval and access. We also will help get to that 80% that we talked about earlier in this podcast.
Well, hopefully we are heading in the right direction. I think we all can feel some confidence or optimism that we are. And next time we talk, we'll be even in better shape with your help.
Well, no, thanks, Rick. I mean, it's everyone's help. We're all in this together. Getting the communication out there is key. We've tried to develop Convinced. It's a network of networks, both global and Convince USA at CUNY. We love to keep speaking with you, with others. We've got many others on our team that we do this in English, Spanish. We're doing our best to get the message, both listen and adapt. There's no simple answer here, and your podcast is an excellent example. That it's amazing that a year's gone by since we first spoke, but we've learned a lot, but there's a lot more that needs to be done, and appreciate the chance to do this again today, Rick.